Okay. Good afternoon, everyone. We are grateful and we really appreciate your presence online and in person. We hope that by the end of this webinar, you get to appreciate wastewater-based epidemiology. So for government sectors out there, government agencies, businesses, and corporate groups, we hope that you would continue to support this research through scholarships, grants, awards, personnel salaries, publication fees. For the scientists and researchers out there, we would like to please sign up for this research. There are so many ways you could contribute. Wastewater-based epidemiology is interdisciplinary and multidisciplinary. So what is wastewater-based epidemiology, or WBE? It uses chemical or biological markers that are sourced from wastewaters, pooled wastewaters, and that provides us information on the overall health of the community. So this can be a supplementary or complementary data set for public health surveillance. So for example, microbial DNA or RNA in the wastewaters, that specific type of RNA that you associate with a certain type of disease or microbe, if it's detected, then it's there in the wastewater and there's some infection from that population. The abundance of this RNA or DNA could also mean prevalence of this disease. So back in March 2020, when we had heavy and strong lockdowns, a webinar was conducted with Dr. Francis de los Reyes, organized by the Philippine American Academy of Sciences and Engineers. That webinar was about the use of wastewater-based epidemiology for, come in please, for SARS-CoV-2 or COVID-19, very early on in the pandemic. So he presented data sets that were from UK, France, and also his data set from North America. So they detected SARS-CoV-2 virus in the wastewaters and identified that community at risk. So for a lot of people who are asymptomatic and does not need to go to the hospital, they didn't know they have that COVID-19. So we lost that data from clinical reports of positive COVID-19. There's a big population of asymptomatic people that experienced COVID-19, and the wastewaters would have this data set because this viral RNA SARS-CoV-2 is also shed off from your body through your discharge. So that wastewater pooled sample is very effective in showing which groups of community would have that kind of disease. Okay, so in some cases, the detection of SARS-CoV-2 genes in the wastewater peaked before the reported positive COVID-19 cases. So in these cases, this has very high potential, wastewater-based epidemiology, to serve as one of the forecasting tools to identify communities at risk or might be at risk. Sometimes there's a lag of 2 weeks between these different data sets. Sometimes there's a lag of just 2 days. But the trends show that this could be a useful tool. So it was serendipitous that around that time, very early on in the pandemic, we were already able to generate data from my USAID peer project. We call it People's Project, which stands for Baselining Persistent and Emerging Organic Pollutant Levels in Environmental and Engineered Systems for Healthy Philippines. The two data sets that were very important from our surveys were E. coli and total coliform. So from these two data sets, we're able to identify which parts of the Davao River has untreated wastewater, and that could be useful for initial surveys on wastewater-based epidemiology, since we don't have sewers that are connected to wastewater treatment plants. So in other countries, they use wastewaters from these wastewater treatment plants. It was very comfortable to use Davao as the pilot study site because we already have data from that area that has something to say about untreated wastewaters. So we were also able to identify pharmaceutical and personal care products from these wastewaters. These are also shed off or discharged from our bodies, or it could also mean that we're very close to those pollutant sources. So with this data set, we were able to narrow down which parts in Davao we could start with. With that webinar with Dr. Francis de los Reyes, it really generated that interest that we can start this off in the Philippines. So, and that's what we did for the SARS-CoV-2, and recruited into our team several researchers, Dr. Dann del Mundo, who will tell you or show her results of her research later. Ms. Catherine Otero will also show her results later, and the rest of the team. So there's varied disciplines within our team. There are mathematicians, geologists, environmental scientists, virologists. There are a lot of tools we could use. It's not just one discipline. It's very multidisciplinary. So we think of waterway as a concept, just like a roadmap or a roadway if you're on the ground. But wastewater-based epidemiology could be one of our waterways as we track public health surveillance, to use as a public health surveillance tool. So I'd like to start